I am super excited to be joined this evening by Dr. Lisa Kluslow. Lisa has put together a whole bunch of great information on functional nutrition and how this can be applied to your patients on a daily basis. So with that, I'm going to turn it over to you, Dr. Kluslow.
Thank you. So I want to start by thanking Jody and, of course, thanking Standard Process because they really do such a great job at continually researching products and coming out with new products that they actually are one of the companies that really do change how I practice medicine and how many clients and patients I can help. So thanks to them. Thanks, of course, to all of you for attending because I know how precious our time is, especially during the week. So I appreciate you all taking this time. A little bit of background about myself. I don't know if you saw on the first slide, I have some of my CE or credential stuff there, but the bottom line is I graduated over 20 years ago. And when I graduated from vet school, conventional medicine didn't give me a lot to offer my patients. And so if we saw an arthritic patient, I really had what? I had 20 years ago, I had Rimadyl and maybe glucosamine and fish oil. And so very quickly in practicing conventional medicine, I got frustrated and felt like I just wasn't helping my patients as much as I could be, as much as I really wanted to be. So I very quickly, like 2 years after graduating, started doing some continuing education. And so I did acupuncture and rehab and spinal manipulation, which is chiropractic, Chinese herbs, Chinese nutritional therapy, and I just kept wanting to add more and more and more to my toolbox. So that sort of brings me to why we're doing tonight's presentation. I've never spoke for technicians before. This was new for me, and I wasn't really sure how this was going to work. And the fact is, I was so excited about it because the fact is, you guys are really the face of the practice, right? We say the receptionists are, but they're the voice of the practice. You guys are really the ones that spend so much of the face-to-face time with our clients, aside from the doctors themselves. So I was really excited to talk to you guys about anything tonight, but the two reasons we decided to talk about this specifically is, one is, as far as I'm concerned, nutrition and functional nutrition is truly the foundation of health, right? And so while my acupuncture training or chiropractic training or whatever, they really do help many, many of my patients, food can help every single one of my patients, and you guys can be involved in that. The other thing is I don't know how many people have practiced or been in the veterinary profession for a long time versus a short time, but for those of you who have been in it for a short time, we really are in a very challenging time in our career right now. When I graduated, veterinarians were considered the most revered and respected profession. That is not really the case anymore. I mean, I constantly hear and see posts about how, oh, my vet's trying to screw me, and oh, they just want money, and oh, like we just have this really weird reputation now. And I'm sure you guys feel this as well as the veterinarians feel. I feel like my clients just want more and more, but want to pay less and less, right? And so it's just a tough time. And so somehow as a profession, we have to find a way to start moving forward. And one of the big ways that we are going to have to move forward is by better utilizing every single person in our practice and having everybody a little able to multitask, but also our support staff is going to have to do more like they do in the human field. And our techs are going to have to basically become like nurse practitioners or PAs, right? And so what this talk will hopefully do for you guys tonight is give you some pearls that you can take back to your own practice, or at least take back to your own pets, because the more you help your pets, the more you're going to be able to help your clients' pets. So hopefully you will get some stuff out of tonight, and I will stop blathering and actually get on with some of the more important information. So as long as nobody minds, I'm going to actually turn my camera off so that you can actually pay attention to what I'm talking about and not, I just realized my utensils are in the background, so you won't have to pay attention to that anymore, and we will get started on functional nutrition. So obviously, we can all agree, whether you're in conventional medicine or not, we can all agree that what our patients are eating absolutely matters, right? But what does that mean? Like, why does that matter? Well, and it matters because there's a lot of different things, right? We can look at all sorts of different pieces of quality of ingredients. That can be because we are feeding, if you're in small animal medicine, mostly cats, which are strict carnivores, dogs, which are opportunistic carnivores. So that means they're not omnivores like we are. They are truly carnivores, except they're opportunistic, which means if they're starving to death, they'll grab apples off the ground, right? But the fact is they are meant to eat meat proteins. So one of the things I'm always looking at is, did my protein come from meat or is it from soy or corn or something like that? Those are not going to be as bioavailable or as supportive to their tissues as vegetable proteins are going to be. Of course, we also look at the quality, at the source. So that can be, where did it come from? Like, is it from China? Or really, is it from a good manufacturing facility or a less good one? What are their ethics? Are they straightforward in what they do? Is it whole food or is it synthetic? We're going to talk a lot more about that, so I'll save that. But another thing is source of calories. A few years ago, we were required to start putting, when I say we, I don't make pet food, but we as a profession, they asked that they start putting calories per cup or, per ounce on cans and bags of food. Well, that doesn't really tell you very much because source of calories does make a difference. A steak and a salad is very similar to a cheeseburger and French fries, but you can't really tell me that those are equivalent foods, even though the calories are the same. They are going to get different nutrients out of those calories. So watching calories per cup doesn't really make the whole difference by itself. A big thing I mentioned is don't forget about snacks. I got burned on this once. I had a patient who came in, a yellow lab. She was 108 pounds. She should have probably been 60. And so that's fat. I mean, that is really, really fat. This poor dog, she was 7 years old and she could hardly walk. So we started working with this older gentleman, the owner, to try to work on this. And I'm telling you, I was restricting her calories. We changed her food to a raw food diet. We did all the stuff. We got her in the underwater treadmill. And that dog, like, I could not get her to lose an ounce. So months went by and finally we are talking about something. And I spend a lot of time with my clients and I think I'm pretty thorough. Somehow in conversation, he goes, well, I guess that means I'm not going to be able to get her Culver's coupons anymore. And I went, huh? What kind of Culver's coupons? As it turns out, every single day, and depending on where you guys are, you may not have Culver's, but it is really greasy cheeseburgers. So they're called butter burgers, actually. And so he was getting this dog, not even a child size, but an adult size butter cheeseburger every single day of her life. Well, no wonder I couldn't get her to lose weight. So don't forget about snacks because it may not just even be the volume, but it may be that you have an allergy patient and they're feeding milk bones or bacon bits or something that is going to be inflammatory. So you're doing all these other things working really good on their diet and their supplements, and they're still doing crappy snacks, or the neighbor is, or whatever. So don't forget about snacks. Another just note is when we start talking about supplements are not FDA approved. So you really do want to look for companies that are doing independent research with outside labs. There's a website called consumerlabs.com where they take no advertising money. And so they do research themselves on different products. And they tell you, like, for example, they did a study where they looked at human, actually, glucosamine products. This was probably 8 years ago. They looked at human glucosamines and, for example, Trader Joe's glucosamine that had, quote, 500 milligrams per tablet or per capsule only had 5 milligrams. So that's 1%. So we do have to be careful with our sourcing of our supplements, but our foods as well. So when people come in with, oh, I have this great new supplement, look at it, I can read the label, and unfortunately the label doesn't tell me a whole lot. So this is where we go back to, I do want my clients using products that have been looked at for quality assurances, right? So quality of ingredients is a really big deal. The next thing is, and the thing that we are going to talk a fair amount about, so I'm not going to talk about it at this moment, is freshness. Freshness does make a difference. And then the next thing is going to be negative side effects. So one of those is going to be obesity, which I already alluded to a little bit, and inflammation. So let's talk about the benefits of fresh food and the downside of cooked food. So I don't know how many of you, and I didn't really set up for chats really easily, like how many are already doing fresh foods, but here is a bunch of data, and I will, on one of the next, it's 2 or 3 slides from now, I will show you all the references for this. This is not that I like feeding fresh food. This is actual scientific data. on what the benefits are of fresh food feeding. So I want to just make that clear because I know there's a stigma in many conventional practices that raw food causes salmonella poisoning and all these different things. And that could that have happened once or twice? Sure, absolutely. But there is a lot of data showing that the pros far outweigh the cons. So that is one of the things I'm going to go through with you guys right now. So starting with fresh foods are more easily digested than extruded kibble diets. It's just how much time is spent in the GI tract. And dogs are supposed to eat fresh foods that don't spend a lot of time in their gut. Fresh diets create less feces. Not a huge deal, except that that does actually impact their microbiome. And we know that those impacts actually change fat and protein digestion. And since we just talked about them not having enough digestive enzymes to necessarily break down their carbohydrates, we want to make sure that they're breaking down everything else, and especially those proteins that are building blocks for their every one of their cells, actually, because the proteins and the amino acids are the building blocks for the DNA and the RNA and everything in the cells. So that becomes important. So I do joke with my clients that less feces is awesome, because it is, and it's so easy to pick up, and it doesn't smell as much, but it also has positive effects on that microbiome. Microbiome, we know, impacts immunity. We already talked about digestion, but it also affects weight. And we are starting to talk more and more about the gut-brain axis. This is fairly new, but I do think we're going to start talking more and more about our microbiome, and that we can take very specific probiotics to have different changes on behavior stuff. So whether this is cognitive disorder in seniors or whether it's anxiety disorders, probiotics are going to make a difference. And I would imagine that shortly we're going to have different probiotics for different mental illness or issues. So it's an exciting place that we're headed, but microbiome is really, really important. Fresh foods also have anti-inflammatory properties. They improve the immune system. They reduce oxidative stress. They reduce the risk of digestive disorders, the risk of obesity, the risk of cancer, and inflammatory conditions like atopic dermatitis. So there's a lot of benefits to doing fresh food. Here are the resources that I talked to you about. I'm not making this stuff up. And as you can see, many of these are real journals, they're books. So this is not opinion pieces. These are actually scientifically documented items. The next thing I want to talk about is the negative effects. We probably talk a little bit more about this in humans than we do talk about dogs, again, depending on what kind of practice you're in. I have a very, I work at an integrative practice, and we obviously have clients seeking us out very specifically because we have a more natural approach. So a lot of my clients are talking a lot about these negative effects of kibble, and they're coming to me because they want to switch foods, and they already have that in their head that they want to do it. And so they just need my help figuring out how and what to go with next. But here are some of the negative impacts that we're going to talk about. And again, these are also documented. Mycotoxins is one of the really big ones that's found in all dry dog foods. So this is regardless of price or quality, right? Anything that has grain has mycotoxins, and that's the same for humans as well. But what is interesting is, of all the dog food recalls over the past 10 to 15 years, many of them have been mycotoxins. And again, this is common because they live in grain. So why do we care about mycotoxins? It's because they have been proven to cause both acute and chronic disease. And low dose chronic mycotoxin exposure has been associated with kidney disease, liver disease, and cancer. Well, what are the things that we see in our senior patients? Yes, we see arthritis. And so we're going to talk about inflammation in a bit. But if I have to pick other chronic diseases, kidney disease and cancer are probably the two of the biggest ones. And mycotoxins are very likely playing a role in that. The next thing about processed foods is most of them are high heat processed. So that is kibble and cans, right? So high heat processed foods contain acrylamides. So the problem with those are they can negatively affect and have toxic effects on multiple organ systems as well as metabolism. So it's the lipid and energy metabolism. They're toxic to the neurologic system. They change hormone regulation and muscle function. They're toxic to genes and they have carcinogenic properties. So they have been associated with those following cancers. We don't see all of these a lot in dogs, but they all exist in dogs. Lymphoma is one of the cancers we see the most in dogs, and that's the first one listed, right? So high heat processed foods cause risk of those diseases as far as cancers. The other thing about dog foods, human food as well, we're talking a lot about glyphosates. Glyphosate, if you're not familiar with it, is Roundup. And we do know that glyphosate is in a lot of ingredients that we eat if we're not eating all fresh foods, and certainly are in dog foods. So that's corn, soy, wheat, barley, beans. And what's interesting about that list of those things is even if some of those say that they are GMO free, they can still have glyphosate on them because they're treated very late in the growing process, and the wheat and the barley, so those late growing seeds are already developing. And so even if they're GMO free, they can end up having glyphosates in the food as well. So what's the deal with glyphosate? We know that they're carcinogenic. We know that low dose chronic exposure also has toxic side effects, liver and kidney. The other really interesting thing, and this research study is going on currently in urine. So I have some documented stuff about detectable levels in the bloodstream, but in urine, there's a study currently going on that kibble eating dogs have 32 times more glyphosate in their urine than human beings. Cats, because they have higher protein and less carbs usually in their kibbles, they have only 8 times what is in human urine. And raw food or fresh food eating dogs have negligible amounts. It's not even detected in their urine at all. So glyphosate is a real deal, and it's in a lot of our foods, especially people that eat a lot of processed, whether it's chips, breads, pastas, things like that. So, this is something that we all need to be aware of. Another thing you've probably heard of is heterocyclic amines. Now, you probably haven't heard that phrase, but what you have heard is that high heat processing can cause other carcinogens as well. And so, like you've probably heard, oh, if you burn your food, don't eat the crunchy black stuff because that's carcinogenic, esophageal cancer specifically in humans. But these heterocyclic amines are in processed foods as well. And interestingly, because they're more bioavailable in dogs, they actually have found these heterocyclic amines in dog hair. So I find that pretty fascinating. That means it's in pretty high concentration in their skin, which means it's also in stem cells and all their other organs. So these have been linked to increased risk of obesity, inflammatory disease, degenerative disease. Again, these are common things we're seeing in our pets. Kibble diets have also been shown to have pro-inflammatory processes or properties, and as we know, inflammation reduces immune function. So again, here are our resources. These are not things that I'm making up. There's real stuff that we need to be talking about, and we're doing a good job at talking about it in humans, but we're doing a less good job of talking about it in veterinary medicine. And I don't, obviously, since I don't feel that way, I don't understand exactly what the stigma is, and I don't know if it's just because we didn't learn about fresh food in vet school and that's the problem, or if there's something else that is preventing people from getting on board with this. But we know fresher is better, and so as I said, people are absolutely on board with this with human food, but they just haven't really thought about it with dog food. And I think that's just because kibble is very socially acceptable. So I try to use a lot of statements like, can you imagine eating total cereal or drinking Ensure as your sole source of nutrition? I mean, can you imagine doing that for years on end? Do you know what it feels like when you haven't eaten any fruits or vegetables? You're on vacation or you're car traveling. You know what that feels like? Can you imagine eating the same food every day for the rest of your life? I say things like this. Again, it a little bit depends what kind of breed the owner has, because the truth is, if they have a lab, you could put cardboard in their dish every day and they'd probably still be thrilled to eat it. No offense, Jody. Our moderator, Jody, has 3 labs. And so, of course, they're not all like that, but stereotypically they are, right? So just because dogs are willing to eat it doesn't mean it's healthy for them. I am willing to eat Cheetos because they're delicious. That does not mean they're good for me. So you kind of have to read the room a little bit before you choose what phrase you're going to use. I also try to remind owners that there is no perfect food. So whether it is raw or freeze-dried or kibble, there is no perfect food. And the reason that is when you think about it, we are choosing one food, whatever good quality food that is, and we're saying it's appropriate for a Great Dane, a Chihuahua, a busy Border Collie, a lazy Basset Hound, a hairless, a Mexican hairless, and a really furry Bouvier or Doodle, right? And there's no way that there is one food perfect for all of those dogs. So what we know is that any specific diet, while it may be an excellent diet and check off all our boxes as a good food, it's not going to be perfect for every dog. So every dog, for some reason, is going to have a little bit of an excess or a little bit of a deficiency in some ingredient in there. And so when we rotate foods, and that includes both brand, because most brands have very similar base mixes from their, from chicken to beef to lamb. So that's not only going to be rotating brands, but it's going to be rotating the meat source. So whether that's fish, lamb, beef, right? And so because all of those are going to have different proteins and amino acids in them. So rotation is the key. It also is going to allow our patients to have a more solid gut. And so they can more easily rotate without getting an upset stomach. So my dogs literally eat something different every meal of every day because I'm constantly rotating through what's in my freezer. And at any given time, I might have 8 different brands and flavors in my freezer, and then when I refill it, it's 8 different ones, and I don't stick with like so-and-so's chicken, so-and-so's lamb. So rotation is the key with us as well, right? So what is the goal when we talk about freshness? The goal is the least processed possible. That is going to be different for every single client, right? Some clients, like I said, come into me and they're like gung-ho and they want to do raw. Some clients, I start to talk about food and their eyes get all glassed over and they're disgusted and they just don't want to talk about raw food. It sounds like a lot of work. So there are other options people can do if they don't want to do complete diet changes. They can do just toppers. Toppers are becoming much more popular. People or companies are selling just toppers now because there have been a couple of research studies that came out and said that just 20% of diet change to fresher food off of cooked food can make a difference. One of them was in puppies. This study was in Finland, was in puppies that when they fed 20% of a puppy's diet fresh food, they had less allergies and atopy as adults. And then the other big one, and maybe some of you have heard about this, the Scottish Terrier and transitional cell carcinoma, all they did was add 20% fresh food and they decreased their risk by 40%, getting just a little bit of fresh food. The other way we can do that is by adding supplements. And so we are going to talk a lot about supplements as well. So another thing about fresh food, and this is true about supplements too, we want them to be whole food. And why is that? Because typically we know that whole food has multiple different components in it that have biofeedback loops. And those can be positive feedback loops or negative feedback loops, meaning one will upregulate either the bioavailability of something or the breakdown of something, or it will negatively cause that. And so these are important. Within one food or vitamin or mineral, we're going to get all these naturally versus when we have a singular component. First of all, they're almost always synthetic because we've taken out the quote piece or part that we think is the most important. And my 2 examples, and I have many, but my 2 easy examples are, we sort of think that lycopene is the most important thing in a tomato. Well, as it turns out, they have actually proven in multiple research studies that consuming whole tomatoes has more health benefits than lycopene alone. And the one that I just listed here is in prostate cancer. It made a big difference eating whole tomatoes versus just lycopene. Alpha tocopherol and vitamin E is a really interesting one to me because vitamin E is a very complex whole vitamin that has 8 different tocopherols and leukotrienes in them. And interestingly, someone along the way decided that just alpha was the really important one and started doing synthetic alpha tocopherols. And really 90% of the time when you go into like Walgreens or CVS, I shouldn't even say 90, I bet it's more than that. If you go into a drugstore and you pull off the shelf vitamin E for a supplement, if you flip it over, it's actually just alpha tocopherol. It is not whole complex vitamin E. And the problem with that is there was a meta-analysis done where they looked at 19 different research studies on vitamin E, and what they found was that whole complex vitamin E at 400 IUs a day is anti-cancer. Alpha tocopherol at 400 IUs a day is actually pro-cancer. So this is where whole food stuff makes a huge difference. And there's a lot of science that goes behind that, and I'd love to talk about it, but I don't. Jody's going to tell me I don't have time. So I'm going to move on. But I really think, if I can't say this enough, whole food eating, whether it's through supplements or diet itself, is so very important. And those pieces and parts, and you know what I'm talking about, like when you read whether it's a pet food label, especially canned cat food, a lot of times, like you'll recognize the first 3 or 4 ingredients, and then all the other words are just big long words. That's vitamin and mineral supplements, right? And so that's very similar to like a 1 a day versus perhaps one of standard processes products like Catalin or Whole Body Support. Those are whole food sources. So I'm just going to touch on a couple other, a little off topic, but really fascinating things about diet. So one of the big ones is nutrigenomics. This is a very new part of nutrition that we're talking about. I mean, it's not that new. I have a book listed here that's from 2015, but I didn't talk about it in vet school. But, you know, like I said, I graduated a few years ago, but it's really interesting. So what it is it's how what we eat will affect our genetic expression. So that's nutrigenomics. Nutrigenetics is how our genetic makeup affects how we process our foods. So they're kind of 2 different things. Nutrigenomics, though, is the one based on what we eat and our genetic expression. This is really interesting because there are a lot of different links between, and I talked about that a little bit with the fresh food thing. There's a link between early nutrition and adult chronic disease, and that has to do with nutrigenomics. The nutrients can either bind to the cells or they can change the cell metabolism. One of my favorite examples of this is omega-3. We know that omega-3 upregulates the gene that breaks down cartilage degradation products. So what's interesting about that, and I oversimplify that as like it's keeping the joints clean. So I use a ton of omegas in my orthopedic cases because omega-3 is literally going to, in a joint that has no arthritis, it's going to prevent additional arthritis. In a joint that already has arthritis, it's going to prevent additional arthritis. So it is a win-win. So this is a very positive thing that we can look at. We also see genetic issues with diets where it actually turns on an obesity gene or turns on an inflammatory gene. So the more we learn about this, absolutely the more helpful it's going to be, because what we eat can literally affect how we are going to live later in life. And what they're also finding is that it will affect our offspring's genetics because we have actually changed some of our genome. So it's pretty fascinating stuff. As you can tell, I could talk about that forever. So moving on, why do we want to integrate functional nutrition into our practice? Well, for the veterinarian, it's actually part of informed consent. So I'm not going to talk a lot about this to you guys as technicians, but it is interesting and it's important to remember that it is part of informed consent. This is Wisconsin's informed consent in our license rules. I know every state is a little bit different, but I believe most states now have informed consent. Ours reads exactly like this. Basically, you have to tell a client ahead of time prior to the treatment of the different diagnostic and treatment options that are consistent with veterinary profession's standard of care and the associated benefit of risks of those options. So what that really means to me is every veterinarian should be giving, and whether it's the technician doing that or the veterinarian, every veterinarian should be offering an integrative approach to each case. So that is going to include diet and weight. Now, whether they talk about health science diet or they talk about, you know, whole food and fresh food, it doesn't matter. But we are all talking about that. Are they too thin or are they too fat? Supplements, food additives, pharmaceuticals. We're all talking about that. testing, diagnostics, follow-up, and then physical intervention. That may just be vaccines, it could be surgery, or in my practice, it's going to be rehab, acupuncture, chiro, laser. Again, I'll do really quick with this. With informed consent, this is going to be what a plan is going to look like in my clinic for an arthritic dog. And I'm literally, these are the things we talked about with the client, right? The fresh food feeding, highest quality possible, weight loss, glucosamine, fish oil, and we go through all of these different things. So it's important to talk about food, and I think a lot of practices are. The question is, what kind of food are they talking about, right? So as far as why to integrate nutrition, yes, it is the law, but more importantly, as we've already discussed in the pros and cons of fresh food, it's the benefits. So the healthier the pet, the better the client, or the happier the client's going to be. How am I going to make a healthier pet? I'm going to use better medicine. And how is that? That's with functional nutrition, because functional nutrition, as I mentioned, is going to get me a lot farther than just offering acupuncture or chiropractic or just a pharmaceutical, just Apoquel. If I address diet and nutrition and all those other pieces of inflammation and pro-cancer and all those other things, I am going to practice both better medicine and I'm going to have a healthier pet. The healthier the pet, the happier the client. Why do I care about a happier client? Of course we all do, because if we have a happy client, they're going to become a loyal client. And a loyal client is going to be confident in my recommendations. So that means a couple things. That means they're going to do the follow-up care. That means they're actually going to buy their products from me instead of just trying to find some other antioxidant online, because I'm going to explain to them why our products are more beneficial, why standard process is better because they have whole food in them instead of pet tab, which is like a dog version of a one a day. So happier clients, improved revenue, but this is really where you technicians come in, right? So this is where techs can be a really important part of the educational process. And not only are you going to help educating our clients, but you're going to also build this bond that is going to further increase them becoming loyal clients, having confidence in our recommendations, etc. So like, to me, this is just a win-win, sort of cycle. Interestingly, JAVMA just this February published an article on perceived barriers to nutrition communication in small animal vets. It was a super long article, so I won't tell you all the reasons, but I will tell you they only came up with 3 solutions. And one of the 3 solutions was empowering veterinary technicians to discuss nutrition. So this is where you come in, right? They also, in this article, proved from a different research study that client engagement in the choice of their care decisions was enhanced by collaborative communication between the client, the vet, and the tech versus just the vet and the client. And you guys have all seen this, right? Like, I've certainly seen it a million times where I send the client up front with a certain product, they get up there and the receptionist even says, oh my gosh, I started my dog on that last month and she's doing so much better. And the client just beams, right? Because we have now added value to a choice that they've made, or if they're on the fence about making the choice, we're actually helping them by them seeing this team that they talk to and they trust and they like, they're doing the same thing for their own pets. So we know that the more people that they hear that from, the happier they're going to be with their choices that they make. And they're going to believe that we're not just like selling them stuff, right? Because we're using it ourselves. The other thing about you guys being able to do more of this client communication and education is it does increase job satisfaction. One of the big things I hear when we hire a new technician is, oh man, all I did at my own practice was start appointments and draw blood. And and while that is a valid thing as well, I feel like you're not going to get as much satisfaction in your job if you do not feel like you are the one helping to make a difference. And while starting appointments and drawing blood is absolutely helping, you're going to feel much more rewarded on a daily basis when you are building your own relationship with these clients. And what often happens in our practice is, specifically, clients will call and want to talk to a certain tech. Sometimes that leads to some phone tags because they're not there or they're doing appointments or something like that. But it really does help build this relationship. And then it, again, goes back to that. We have a happier client and a more compliant client, and now we have healthier pets. The other bonus, of course, is, as I talked about early on, we need to move forward as a profession. And how are we going to do that? And how are we going to keep up with the rising costs of us actually running a business? And that has to be with greater clinic revenue. And that is going to happen by you guys taking some of the education off of the veterinarians' plates. And that was one of the reasons that vets complained. That was one of the barriers that they complained about, is they just don't have the time to do a good job talking about nutrition. So the next thing I want to talk to you about a little bit is, how do we go about this? You know, it's not rocket science. The first thing I always tell people is, you really do need to be humble, because the bottom line is, I see, and you guys see, multiple different breeds in your practice, certainly. And I also don't have all the current research coming out all the time on new supplements and new things. So when somebody who has, you know, I don't know, a Shar-Pei. Yeah, I see a few Shar-Peis, but certainly I don't see 1,000 Shar-Peis. So when somebody comes in with a Shar-Pei and they're like, hey, I just read this new genetic test, I'm like, oh, interesting, tell me more about it and give me a link. And I'm going to research that later so that I can help them make educated decisions as whether that test is worth doing or not. But the other thing is supplements, studies, resources, ingredients. I have astaxanthin up here. Astaxanthin, I actually learned about from a client probably 12 years ago. Now it's far more popular, but astaxanthin is amazing. It is it is the strongest natural antioxidant that we know of today. And it also crosses the blood-brain barrier. So I love astaxanthin. I'm on it. I now have a lot of my clients or patients on it that have neurologic disease because it crosses that blood-brain barrier. But how did I learn about it initially? From a client, right? So be humble and know that we certainly do have clients doing the Google search and coming in with some ridiculous things. Don't get me wrong, that happens a lot. But we do also have clients that come in with good information. So we need to take a minute to really figure out which it is. Be understanding whether it's about what they do or they don't know, because it's both, right? So I try to introduce ideas slowly, without judgment, and making a client feel guilty helps no one. What happens is if you make a client feel guilty, they will either leave or they'll go get their information from somewhere else. So what happens is our patient does not get the care that they deserve. So I always try to remember we are on the same team. So the beautiful thing about functional nutrition is it changes outcomes, and it changes outcomes safely. And it also allows clients to feel like they are doing something, and clients want to be empowered and feel like they're making a difference. The big thing that I think is important in this process is monitoring the progress. And the reason we do that is obviously multifold, but one of the things monitoring does is it gives value to the fact that I actually believe in my recommendations. So what I mean by that is, we have some supplements that are going to change outward symptoms. That is going to be, pain relievers, things that help the skin if they have itchy skin, things like that, right? And so I have owners actually keep a log. I tell them, please don't make it fancy. I don't want a whole, I don't want a diary when you come back in, but on your little paper calendar that you have for the family on the fridge, in every square, pick 2 things you're going to monitor. And whether that's like, say it's how easily they get up off the floor, how easily they go up the stairs. I have them do one thing that they came in for that was a complaint. And then I have them do like, overall, how is the dog that day? So whether it's itching, seizures, whatever it is, I have them keep a log. And what that does is it allows them to objectively look back and see how well our product is working. Some supplements are going to take time to change, right? And it's going to be things that the owner can't see. So those, we're going to recommend appropriate blood testing or lab testing. And by coming up with appropriate time frames, this is where the value comes into the client, where they say, and I'm talking about it before they leave, say I'm going to put them on milk thistle or Denamarin or whatever, I'm going to say to them, hey, we're going to call you in 2 weeks and we're going to recheck an ALT, because I believe that this product is going to make a difference. And then I'm going to prove that it either did or didn't. If it didn't, now we're going to come up with a new plan, right? So we choose specific timeframes and we talk to the client about it so they feel good about our plan as they're walking out the door and they don't think I'm just trying things, right? I like to place, we have a computer system where we can place callbacks. I love that because again, I call them back at the agreed upon time. And they either come in and do blood work or they just have a conversation with whoever calls them. Again, we usually have the technicians call them. So here we are back empowering the technicians to answer those questions, to build that rapport with the client. And again, it's a win-win. We get to see how the pet is doing. We haven't just sent them out the door with 15 things, and the clients feel good about this plan. So here's what's happened. We now, when we have a functional nutrition approach, we get to change like, I'm so sorry, there's really nothing more I can do, into, all right, here's what we can do for you today. And I will tell you, that makes my clients really happy. People a little bit joke about this with me because they tease that I'm a little like MacGyver. If what I did doesn't work, I can come up with another plan. If that doesn't work, I can come up with another plan. And again, I'm not making things up. I am looking at the process of how these supplement works or how the diet works, or whether it's even through Chinese medicine, is it heating up the process or cooling down the process? And I can look at these things from a physiologic standpoint and come up with a new plan. And sometimes it's not a plan that's documented. I mean, meaning proven by scientific research, but I can say, hey, I know this herb has anti-inflammatory effects, and I know your dog has this weird inflammatory disease that I've never seen before. So I can't tell you for sure that this product is going to work, but you know what? It's going to, because it's anti-inflammatory, right? So I really do love what this buys for us. There are a ton of disease processes that respond well to functional nutrition alone. I'm not saying that you only can do functional nutrition, because the beauty of functional nutrition is it can work most of the time very well with whether it's surgery, pharmaceuticals, or other things. So I'm going to really briefly go through some disease processes just to put them in your head. I know that technicians cannot recommend or prescribe treatment. So I totally get that, but the more you understand how this works, the more you can share it with your practice, or if you're not already using standard process, you might be able to talk them into getting standard process in, because they're going to carry most of these products in their product line. Or it's going to allow you to just think out of the box, whether it's with your own patients, and then you can start doing some of that and encouraging your doctors to do it, your coworkers to do it. And so again, you guys can be really empowered. And I do think there are going to be things that techs at some point are going to be like nurses assistants, or physicians assistants. And so you're going to be very like PAs. You already are, you just legally don't have all the rights. But that is going to have to change for us to keep up with the changing demands of our career. So here are a few to keep in mind. And I encourage you too, you can certainly print these notes, right? If you need some ideas or need to remind yourself of some ideas. So arthritis, probably most of you guys are already doing glucosamines, chondroitin, green lip mussels, joint supplements. Omegas, again, we talked about this. Omegas are both anti-inflammatory, but they also do that nutrigenomic thing where they help keep the joints clean of degradation products. So all my joint patients, regardless of the issue, whether it's arthritis or OCD or anything like that. These guys are all on both a joint support, meaning glucosamine chondroitin, and an omega. Glandular supports are fantastic. Standard process has some lovely ones, right? And the nice thing about the glandulars is they are designed to help white fibrous tissue as well. So not just the cartilage like the glucosamine and chondroitin, but the white fibrous tissue, which is the ligaments, the tendons, the joint capsules, the muscle insertions. So they're very much a more whole body musculoskeletal support instead of just a joint supplement. Anti-inflammatories, this can be herbal like boswellia or poppy, cat's claw, or pain relieving like turmeric. Gotu kola is an herb I use a ton. Gotu kola is an herb that increases microvascularization to white fibrous tissue. So I kind of think of Gotu kola is to the joints like ginkgo is to the brain, right? So I use a lot of Gotu kola in partial ACL tears, joint capsule issues, biceps tendonitis, things like that, to get that blood supply in there. So those white fibrous tissues that don't like to heal can actually heal some with a good blood supply. There's many others, right? MSM, acetyl-M, hyaluronic acid. If you're not familiar with hyaluronic acid, I use a lot of that as well. That is the product in the joint fluid that makes the joint fluid more viscous. The more viscous and rich the joint fluid, the more cushion in the joint, versus when there's inflammation, joint fluid becomes watery. Watery joint fluid is not going to have as much support. GI tract disease. This is everything from esophagitis, gastritis, upper GI, lower GI, colitis. And the reason why is that organ, while we talk about it as multiple organs, it's one long tube and it's all connected as one integument, right? So while I might use different things a little more heavily, whether it's upper GI or lower GI, the concept is all the same. I use a ton of prebiotics. Prebiotics, you may know, are fructooligosaccharides. These are the chain length fiber that that feed the good bacteria, the flora in the gut. So that is pumpkin. Pumpkin's probably the most common one, but that's a ton of other stuff. It's banana, Jerusalem artichoke, apples, barley, berries, flax, cabbage. So there's tons of probiotics. I got to be honest, most of my clients do pumpkin now that you can get freeze-dried pumpkin. It's really easy. You can keep it on the counter, just sprinkle some in the food. Digestive enzymes is another big one. I use that for whether it's reflux, whether it's gas, whether it's farting, because a lot of these GI diseases that we see lead to gassy things or moist burping and things like that. And that is because we have food that is not very digestible to the dog sitting in its stomach fermenting. And when that happens, it makes gas, right? So I use a ton of digestive enzymes, again, anti-inflammatories, glandular enteric support, so it can build healthy GI tract. Clay is another one. I use that mostly just for watery or soft stools because it just binds. So it's a really nice, safe, easy thing to use. Skin disease. Skin disease, we know we need to address the gut, right? We talk a lot about, and if you haven't read about it, I encourage you to read about leaky gut syndrome. And the reason we talk about that with skin disease is because 60+% of the immune system is in the gut. That's where 60% of those lymph nodes are, right? So that is very important. So the first thing I do is I talk about the gut. Then again, anti-inflammatories, that can be omega, that can be glucosamine, antioxidants, glandular immune support, medicinal mushrooms, colostrum, any sort of immune support, and then antihistamines. I love herbal antihistamines. We know that antihistamines are not, drug antihistamines are only 40% effective in dogs. I find that herbal antihistamines have a much higher success rate. I wouldn't say that they're 100% effective, but they're certainly more effective than Benadryl or Zyrtec. I will say though that with this natural approach, this is going to take time to heal these inflamed, angry guts, which then take time to quiet the immune system. So I have a short-term plan and a long-term plan. This nutritional approach is my long-term plan. Short-term is going to be whatever buys them relief, whether it's topical steroid spray or bathing or Apoquil for a short couple weeks. You know, I'm not talking about doing those things for a long time, but almost all of them, the dog in the picture certainly went on antibiotics and maybe even an antifungal. So we kind of have to look at both. The next group, I'm grouping together some kind of weird things: autoimmune, inflammatory, neoplasia. Why are those all together? Because they're all related to the immune system. Because the immune system is either overreacting, underreacting. In the case of neoplasia, it's not paying attention to the cancer cells. So it's allowing the cancer to overgrow. So again, I'm going back to the gut. And then I'm doing the last slide, which is the immune support. But then I'm also doing medicinal mushrooms. Medicinal mushrooms are so immune supportive, and some of them very specifically have anti-cancer effects. Antioxidants can be incredibly helpful, again, because they're anti-inflammatory. It's very important, though, not to use them with chemotherapy. So this is where you have to have time. When you're going to do functional nutrition, you have to have time to have a real conversation with these clients. And so I can't do a cancer consult in a half an hour appointment. I can't, because I need to know, are you planning on having surgery? Are you planning on having chemotherapy done? You know, have you gone to an oncologist or not? So we really need to talk about the big picture with these guys. The nice thing, again, about all of this stuff is it can be very safely used. Again, not antioxidants and chemo, but everything else can be very safely used with whether they do surgery, chemotherapy, or end up having it as standalone. And then my very last slide, and a lot of you guys have probably heard about this too, is hepatopathy. Milk thistle and SAMI, we often sometimes use that separately. Together, that's basically Denamarin. Most clinics carry that. Turmeric is a great anti-inflammatory to the liver. And then glandulars. Again, the glandulars from Standard Process are specifically the amino acids and proteins that support those cells to repair. And we know the liver wants to repair, so why not give it the tools to do it? Renal disease, this is another one. Glandulars, feline renal support has literally changed lives of, I would say, half of my senior feline patients. So I love glandulars. Azadil is a nice probiotic that competes with nitrogen producing bacteria. So this can decrease the BUN, and it's a probiotic. So that's a win-win. Thyroid disease, glandulars work great for hypothyroid dogs. Chinese herbs work great for hyperthyroid cats. Cardiac disease, again, glandulars. You'll see, I mean, glandulars are on each one of these, right? Because it is the pieces and the parts that support the cells themselves. And this is what functional nutrition is. We're using our food to support the body and let it repair. And then lastly on here, I have behavior/cognitive. We are doing a ton of, whether it's probiotics for anxiety disorder, herbals, amino acids and proteins. You know, probably a lot of people have heard about things like composure, the 3rd of July, things like that. Those are amino acids and proteins that help to release serotonin from the brain. So those can work great. The omegas can work great. So there's always something that you can find in these whole food products that are going to make a difference in the quality of life in your patients. So that is my conclusion, and we do have time for questions. And so I really just encourage you, you know, if your practice itself is not doing all this stuff, start doing it yourself. If you can get, you know, your coworkers and your veterinarians and some of your owners on board, you're going to start seeing successes in your patients, and then that is going to further get people on board, right? So again, it is just a win-win for everyone, and it really truly gives you the power to make a difference.